Hello, everyone. Welcome back. We should start with the next session, so please you can still grab your coffee and come. Okay, we can start now. Welcome back, everyone. I'm Mireia Figueras, and I'm the Climate Program Manager at Healthcare Without Harm Europe, and I will be the moderator for the second part of the morning. We will now move into the healing environments part of our morning. So this is the first session of healing environments, and we will talk about sustainable and resilient hospital buildings. Hospitals are more than just individual buildings, we know that, but buildings are the core components of every healthcare facility. This session will explore how design choices, construction, and renovations create healthier hospitals for people and the planet. By prioritizing climate-smart and resilient buildings, hospitals not only minimize carbon emissions, but also improve patient care and staff well-being. I would like to introduce our speaker, Maria Stamenkovic of Capital Region Denmark. Maria is a committed and curious environmental engineer with a focus on solutions for waste, energy, and the environment. She has long international experience, especially within the construction industry, where she has worked to introduce and implement strategies for sustainability, with a focus on resource consumption and sustainable procurement. Welcome, Maria. The floor is yours. Yes, so for the slides.
Thank you for giving me opportunity to come here and represent or present how in Denmark, in Capital Region, are we working with sustainability and how we build, operate, and renovate our hospitals in a sustainable way. So I start first with a little bit explanation of what Maria started there. Like, this is Capital Region, and this part here is like small part is Central Region where I'm working. And Central Region works in that way that we operate hospitals in a capital region. That we operate hospitals and psychiatry centers and medical facilities in Capital Region. And we have centers that are like holding administration and supporting all the hospitals. And I'm working here in the Center for Real Estate. And Center for Real Estate is established in 2017 when we centralized more what we are like doing for hospitals. We centralize our operation part. We are building the hospitals in the Capital Region, and we are also like renovating them. And we are responsible for approximately 2 million square meters of hospitals or healthcare facilities, and more than 500 renovation projects are like going on every year, because we like our hospitals are also like quite old and needs renovation. We have also like 6 large construction projects going on now. And because of that, we talked about sustainability. How can we also build, renovate, and how can we operate our hospitals in more sustainable way? What does it mean for us to like operate and construct and renovate in a more sustainable way? What are our focus areas? And we have like in the Capital Region, we have a program that it's called like Green 2030, where a lot of initiatives how to make our healthcare system more sustainable are like rooted. And construction, renovation, and operation are one part of Green 2030 program. And our vision when we build, renovate, and operate the hospital is that we build with care and we build on top of the care. Because the main thing hospitals and healthcare system is like, there is just to care about the people, to care about our patients, but we build also on top of it. We build with care for the nature. We build with care for like our budgets also, because that's really important. We also build with care for our like patients, our employees, and everyone that are coming in the hospital or going through the hospital. We have also some of the focus areas, and we build like our sustainability on 3 pillars of sustainability. So we have focus on quality and economy, where we talk about life cycle assessment, life cycle cost assessment also. So when we buy something, what does that mean when we need to operate that thing? Why we need a new scanner, for instance? Do we need the new scanner because it's really costly? What are the benefits there? How can we operate that? Do we have people that can operate, because technology goes further? So we need also to think about our employees and their like how we are going to train them, how we are going to make also that we like operate in a timely manner so that our operations are not longer than they should be, or how we move waste from point A to point B in the hospital without influencing patients and without going through the point D, for instance. So we think a lot also about environment. What are we buying? How we are buying? We think also a lot about reuse of materials when we build, but we think also a lot about chemicals in the materials and how our buildings are influencing people that are inside of the buildings. Indoor climate is quite important. We spend, as like our employees spend at least 8 times per hour in the hospitals. So it's their working environment. Our patients are sometimes there even for longer. So it's really important. How is the indoor environment? How is the acoustics? How is the lighting system, so that they feel comfortable when they are there? That's why we talk a lot about positive user journey for like our employees, but also for our workers and also for our patients. And with all that in mind, we had like couple of really, like we call it capital projects, really big construction projects in the region. And we said like, okay, how can we implement our thoughts? How can we put them into the practice? And we started with the children's hospital, the new children's hospital called Mary Elizabeth. And like this is like the time frame where we started with the design. How are we going to design the hospital that is friendly for the children, that is, as we call it, like playful, but it's also logical, so that you don't need to go through different points to find your way through the hospital, but that it's intuitive, that is also intuitive for our employees, that it's also like green inside and outside, that is built with materials that are sustainable. So it was a lot of questions and a really big puzzle that we needed to like put in a place together with architects, together with constructing companies, with all our all people that worked on a project. And we are now in a constructing phase, and we hope to move in the hospital in 26. But how it started? It started, this is the hospital, and it started with this blue field where we looked at the old building and we asked the question, how old is this building? And the building is from 1928. So it's quite old. Can we renovate it? We can, but is it going to fulfill the needs of the future? So the needs of new patients that are coming, the needs of new lasers, the new need for the like our employees, for the new needs for doctors and nurses. No, it's not going to fulfill. And that was like, and then we made also like really big analysis of the environmental impact. What is going to be environmental impact if we build new, or what is going to be environmental impact if we renovate? And what are like flexibility needs? What are the needs for the future hospital? And everything taken into account, we found out that, yeah, unfortunately, we need to build new. But how to do that in a more like environmental manner? Then we said like, okay, we have a hospital that is quite old, but at that point of time, not thinking about sustainability, people were building with like dissembling in mind, actually. And we were quite surprised to find out that we could take brick by brick out of the building, that we can reuse many of these materials. Many of the tree constellation that was inside could be reused or could be sent for recycling further. Then we put everything on the table and we said like, we sit also with our entrepreneurs and we sit with them and said like, we want to reuse or recycle as much as materials as we can. Or if we cannot use them, because there is also not really big place for like storing the materials, if we cannot, so we need to send them, and we want to track where these materials landed in the whole material way. And this is just the example, like from all building, 90,000 tons or almost 20% of materials were sent further for reuse or recycling. And all of these like trees, like construction tree, tiles. We had also some really nice like artistic works that we also sent further. And we took actually like brick by brick. So do you see that big like machine there? It was actually done in that sense that like a lot of bricks were also reused directly, and we reuse also drywall or like gypsum. And we said like, okay, but now we want to build a new hospital. How we can do that so that it's both playful, that it's logical, but that it's also sustainable. How we make that puzzles to match. And that's like how it's going to be. This is what a hospital is going to look like in the future. It's like two hands that play with each other, and every part has inside gardens. There are like solar panels on the top of the building. There is also like a skateboard line there. So we sat there, and we call this like fingers, and every finger has its own role, and every finger has its own colors, materials, so that people come to hospital, they come by and they know where they should go by colors. And because it's a children's hospital, this is how it's going to look from the street view. And it's made also with the light materials so that our CO2 consumption of the building is also lessened, or carbon footprint. This is how it's going to be inside. This is like for the first time, we challenge that the hospital needs to be sterilized and needs to be just white. We said like all the materials in the hospital, it's a children's hospital, all the materials need to be tactile. You need to touch them, you need to feel them, kids need to play with them. So this is also like a part of the building where children can actually play. Because we said like, though these children come to the hospital because they are sick, their everyday doesn't stop there. They don't know what it means to be sick, why we need to put them in hospital beds and make them even more sick. So let's give them opportunity to play when they can, and to use materials that are inside of the building as a playing materials. So in that sense, we made a hospital that is playful. And we made some design principles like integrated play, designed for everyday use, because everyday life is reality. That people come to hospital doesn't mean that their everyday stops. No, every day goes, and we need to move And we need also to show the people that because you're in a hospital, your day doesn't stop here. So you can shop here, you can play here with your kids, you can also take them, because there is going also to be a small cinema there. So you can take them to cinema so that you can explain to them what is going to go through the day, because we made also like some special magnets that show their way through the system. So they show, today we are going to talk with the doctor, then we are going to go to take some exams. So and they can play with those magnets, they can put them on different points in the day, so they can feel a little bit more heard and a little bit more like responsible and a little bit more like I am in charge of that, what is going on here, and not the doctors. And then it's really important that they have a good journey through the hospital. And we talk a lot about clear zones so that they know how to move through the hospital without getting lost. And playful hospital is not playful only for the children. It should be playful also for the people working in it, and also for the older, because it's not only the children hospital, it's also hospital for mothers and for women that have some problems. And this part is actually a test pilot that we made something that doesn't look like a hospital bed. And this is for women who lost their children at the hospital. They will have their separate wing, so they don't mix with those that just got the kids. And we didn't want them to feel like that experience that is really terrible is also like really sterile, and it's really like sprayed with all the equipment around them. So we put equipment away as much as we could. We made the bed looking as much as it can as you are at home, and the bed has wheels, so it can be put on a different sides. All of the shelves can be moved, and also these ones, so that also people that are working there can move them around by their need. And also all of those like inside furnitures can be moved away and like locked on the, or like hanged on the, on the wall. And this is what makes it more like friendly, playful, though it's not maybe the best place to call it playful, but it's playful in that sense that you can play with the different things and move them away. And this is what we call also that it's really important that we think more how we can do things differently when we think about sustainability. Hospital is also logical, so that you know when you come in where you should go and what are like the steps through the buildings. But it's also sustainable. Sorry for this one. It's much better on this screen. But we think a lot about indoor climate. We think about energy, and also like how much does it cost to have solar panel, not just how much carbon footprint are we going to save, but what is a really like carbon footprint saving? What does it cost also to purchase solar panels? Then we talk a lot about daily optimization, economy, work environment, choice of materials inside, as I was talking about, intelligence also with sensors, rooms, and like medical technology solutions. And we are going also to reuse rainwater for like our green environment, indoors environments. This is environmental part of it. And it's, sorry. And yeah, how it's going now. This is the now stage. So now like the building is like finished outside. Now we are moving inside. So the ventilation system moves in. And you can see more on LinkedIn. We had also open house where children and their parents could come in and give us also input to us, like what they think, what do they need. And if you come by Copenhagen, there is also a test house that is one-on-one model, because we test it first there. And we test it first there also with our midwives, with our nurses, with our doctors, with our patients, all from those little ones to the older ones, how it's going to be. What are we going to use it for? Is it useful? Can you see how you are going to use these things? So that was like the model one-on-one. So I mean, we are from Denmark, we like Lego. So that was our first Lego block in making the big building working. So yeah, that's it. And this is how we approach to sustainability in Capital Region in Denmark. And just to say, these are the pipes in the hospitals. So just to see that it's not so easy to build the hospitals. These are the pipes, ventilation lines, and heating systems. So
Thanks for. Wait, is it working? Yes. Is it working?
no.
Nice still here?
Yeah.
And I will give it back. Thanks, Maria, for the great presentation. It also gave us the perfect background for the discussions in the afternoon. We will now take a couple of questions together, actually, and then you can answer both at the same time for the sake of time, because we are a bit delayed. But Maria will be here the rest of the day, so you can also approach her and ask questions, and we will discuss about the topic in the breakout. So I will take now a couple of questions. Yes,
Yep.
I think I was here, Anders and
Anders Månseth from Sweden. Yesterday I was speaking about PVC and the problems with PVC, medical devices and toys and things like that. I did not mention flooring. That's one big issue in our hospital, especially when you have new PVC in the flooring, which actually evaporates, phthalates and things like that.
Yep.
How do you deal with that? Do you have a substitute for PVC in flooring?
Yeah, we don't use, actually in flooring, we use linoleum as a flooring, and every part of the building that doesn't have linoleum has tree, and those play parts of the buildings, we say that it needs to be cradle to cradle materials. That is what we wrote in our tender. So that we need, or we want materials that are cradle to cradle, or products that are cradle to cradle. And we are testing that. We don't know actually at this point of time how much of that would be possible.
Yeah,
because we are still not that far away in our project. So in tender, it was possible, and they said that they are going to provide, but we need to see how it's going to work in the real life when that
it
comes.
depends on the ward. What is going on? Is it operation theater or what is it?
Yeah.
So
in operation theaters, we use linoleum. So every part of the hospital that is not for playing or that is not for administrative use has linoleum, actually.
Thank you.
There was a question there.
Hi, Jess from Lexico's consultancy in London. We're wholly owned by Guy's and St Tommy's Hospital, and I suppose the question in the NHS is, how do you evaluate new versus refurb, and if there's any sort of short summary you could give on how it was weighted towards new, because I think spend normally overrides what the possible environmental decision should be.
We had actually an expert looking on the building, and we have now, because now it's coming actually as a law in Denmark that you need to selectively demolish the buildings. So it comes as a law in 24. But we were like having a test with Copenhagen municipality, and we had experts going through the building, and looking at the building structure and when it was built and what materials were used, and then testing the materials, how good they're how good they are, how much damage from the time and from the weather they took and everything. And then we calculated what is the possibility for like reuse or recycling of those materials. And then we look how much would it cost, like EPDs and life cycle assessment of brick and then of concrete. So we focused just on like biggest materials. So we didn't went through whole building. We focused on concrete, on tiles, on roofing, on bricks, and on the wood like work around. But this is how we did it. So we made a comparison of that, what we have and what is going to be when we build a new one. And in the tender process, we also asked for life cycle assessment analysis. And that is also coming as a law actually in Denmark, or it is already from this year, that you need to do life cycle assessment of new building before you start building it, because after our new law, you cannot have more than 12 kilograms of CO2 emissions per year, like operating per year from new buildings.
Okay, so I'm afraid that we cannot take more questions, but like I said, Maria will be here also during lunchtime, and we can continue the discussion in the breakout rooms and at the end of the conference. Thank you.
Thank you.